Hello, my name is Julie Ramirez. I'm doing Biology 225. We're on the 8th week, and I'm going to go ahead and do my presentation. I'm going to start with the diagnosis of an unknown bacterial infection in a 13-month-old patient. This patient symptoms were fever that were lasting over 2 days. The initial findings were abnormal laboratory results. Also, the CT scans were showing abnormalities, but overall, the abnormal labs were more of the white blood cells count were abnormal at the stage, which was identifying that there was some kind of infection going on. So to identify the causes of the infection was to initial the correct treatment. Delaying the improper treatment can result into serious complications like, for instance, sepsis and long-term damages of the kidneys if not treated correctly. The method that we used were broth method, which is a septic methods, were to make sure that the area was clean, sanitized, and gloves were worn, making sure that the surfaces were clean and just preventing cross-contamination. The tube was also sterilized with flame for 10 seconds to maintain sterile at all times. Then after that, the broth was also used, it was used for a second step for isolation strike plate on an agar. With this, we did zigzags patterns across the agar, separating the bacteria and just pretty much watching the growth in the individual colonies. Incubation was also performed, which was 48 hours. And observation was to maintain and see what the bacterial growth was on the straight plates. Now, the third step was the MSA agar. This identifies the ability to have high concentration of salt. What this usually does, it has an organism that causes growth in the environment. And you can see how the bacteria reacts to the mannitol formantin on the agar. And that actually helps identify the bacteria. Then the EMB agar was the second step to determine the bacteria ferment lactose. What this usually showed was the like a purplish color of the fermentation after the 48 hours of incubation. The growth patterns on both plates will show the bacteria of the ferment mannitol and the EMB plate, which helps the lactose fermentation that is happening. This will actually help diagnose the patient's infection. And then we went ahead and did the oxidase test and the catalyst test. The oxidase test will determine the bacterium produced by the M size. Usually it would turn either purple or blue, and that takes 10 to 60 seconds after using the hydrogen peroxide drops. If the catalyst test is used, you'll see the bacterium produce the enzymes catalase, which will break down the hydrogen peroxide into water and oxygen. So if you see bubbles form in the hydrogen peroxide, that would mean that the bacteria and the catalyst is positive. And if there's no bubbles in the bacteria, the catalyst is negative. Now moving forward, we did the Kirby-Bauer method. With this is a very effective differentiate antibiotics, which are using on the plates disc on the agar to measure the zone of bacteria. You would compare the size of the zones for the bacteria, which was bacitracin and tetracycline was used, which was determined that the higher dose of the bacteria would be considered that you would have to use a more stronger antibiotic depending on the bacteria for this treatment. If it was the gram-positive bacteria, again, it would show the chosen for the treatment. Now, the outcome of this antibiotic was susceptible testing, which showed that the bacteria reacted to the different antibiotics, helping to confirm that E. coli was present and determined by the best treatment for this bacteria. And then I have 5 citations on the presentation. I'm going to go ahead and add this video aside because unfortunately I couldn't add it to my presentation slides. Thank you.